Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of pediatrics on the topic neonatology, and the subtopic will be pathological versus physiological jaundice. So let's start.
Welcome to this session on neonatology basics. Can you start by telling me the difference between physiological and pathological jaundice?
The physiological jaundice occurs after 24 hours of life, while pathological jaundice occurs within first 24 hours of life. The duration of physiological jaundice is up to 2 weeks and it resolves after that, and pathological jaundice remains after more than 2 weeks or can be more than 3 weeks also.
That's right. Now, could you tell me what are the typical clinical features you might observe in a baby with pathological jaundice, apart from the early onset?
The clinical features will be high TSB levels, conjugated bilirubin will be high, and there can be hemolysis, infections, and obstruction.
You are on the right track. Yes, high bilirubin levels would be present, and conjugated hyperbilirubinemia is indeed a concern. When you mention hemolysis and infections, what specific clinical signs might point to those underlying causes?
There can be hepatosplenomegaly and fever in the child, and it might refuse feeding.
Excellent. Those are important signs to look for. Now, consider a 3-day-old neonate who presents with significant jaundice. What would be your immediate approach to clinically assessing this baby?
We will assess using Kramer's rule, which provides a cephalocaudal head-to-toe progression of jaundice to estimate bilirubin levels. There is zone 1, head to neck, zone 2, upper trunk, zone 3, lower trunk and thighs, zone 4 are arms, and zone 5 is palms and sole.
Excellent. Those you have described the Kramer's rule correctly. Now, considering that the baby is 3 days old, at what point would you consider bilirubin levels to be high enough to warrant phototherapy?
When the TSB levels will be more than 15 milligram per deciliter at up to 72 hours.
That threshold could vary depending on specific risk factors, but around 15 milligram per deciliter is a common guideline for this age. Are you aware of the chart used to make this decision precisely, taking into account other factors?
No, can you please explain?
Certainly. The charts usually plot the total serum bilirubin level against the baby's age in hours and include different lines for babies with varying risk factors like prematurity or hemolysis. It guides whether phototherapy or exchange transfusion is needed. Before we conclude, can you quickly tell me one potential complication of phototherapy?
I don't know.
That's all right. A common complication is increased insensible water loss, which can affect hydration. We have covered quite a bit today. Thank you for your participation. Please note that the information discussed is for